My name is Dr. Amir. I'm a medical obesity specialist, and I have the pleasure of having Miss C here with me today, who's been a patient for the last few months. Wanted to share her experience. So, how long you been with us now?
About 5 months, 5.5 months.
And how did you come about finding our office and finding me?
I found you through my sister who already used you as her doctor and had good results and was pleased and told me to get a move on.
Got it. Okay. And did you know what an obesity or weight specialist doctor was before?
Not exactly.
Okay. What is your opinion now?
That you're someone who's a doctor who knows about my medications and different things that I've got going on because I'm older and can work with that and can work with the injections and can work with the food and what's right for me.
Excellent. And do you feel like you're on some kind of a diet?
Not really. No, I'm learning to eat properly now.
Ex-
I've been on many diets and many meal plans, but now I'm more aware that protein is more important than fat. And I'm more aware of this and watching out for it a little more. And I need to get a little more active. But I've lost 30 pounds, 35 pounds already.
Congratulations.
Thank
I'm
you.
really proud of you. That's great.
And lost a bunch of it even before we started the injections.
And that was through just
The
eating properly?
Yes.
Yes. So a lot of what we do in here is nutrition guidance, and it really helps our patients, with jumpstarting and changing their health permanently, not just for the duration of this plan, right?
Yeah.
Okay. And everybody is currently, obsessed with the injections. Do you feel like that was a big part of your treatment, or do you feel like it was?
Not in the beginning. In the beginning, we had trouble even getting it approved.
Okay.
So for the first month and a half, it was mainly just your meal plan, protein, read ingredients, less, what is it called? Chemical
It's
or
chemical, less processed.
processed
Yes.
items. So I was more aware of it and I lost like a good 10, 15 pounds
Hmm.
there. Then I started the medication and I had some trouble with it at first. So I'm on a low dose. So it's not totally the medication, it's that, the meal plan, the watching, the communicating when I need to.
We keep a good eye on you in the
Yes,
office, right? Do you feel
yes,
like
yes,
somebody's always watching you?
yes, because you have a
Yeah,
not a website, what
an
do you
app,
call it?
the app.
An app where I can check in with you as often as I want and you'll get back to me. No, that wasn't a good thing, a good choice, or yes,
Do you feel
do
that
that.
you
Yeah,
feel that that's helped your
yeah,
progress,
yeah,
just having the support along
yes,
the way?
yes.
Great. Well, where do you see yourself in the next few months? Where do you?
Oh, I hope I keep losing. I'm losing slowly, believe it or not. Um, but I guess that's the best way to do it, and it'll stay off.
Absolutely.
And it's not a diet that I'm doing.
Correct.
I'm mindful of what I eat, even though with other plans I wrote everything down, but I just know the right way to eat, and I'm not as hungry, and hopefully this will continue.
So we're going to continue assisting you in losing additional fat. And we've worked together with some of the specialists that you see as well to make sure that we're, giving you the right combination of medications to help your conditions in general. So it's not a one size fits all. It's very customized to you. And I look forward to your success,
Thank you.
continued success.
Thank you.
Great. It's a pleasure treating you.
Glad I met you.
So let me stop that. I think it's perfect.
Good.
Yeah, I don't have to do anything else.